Hello, welcome on my YouTube channel Learn Medicine. On this channel, we are going to cover the pharmacology subject of our Bachelor of Pharmacy. This is my first lecture on it. In this lecture, we are going to cover the introduction of pharmacology, the definition, and the divisions of the pharmacology. Introduction to pharmacology. In simple words, pharmacology deals with the study of drug. It deals all aspects of drugs include pharmacodynamics, kinetics and toxicology of the drugs. There are many other aspects also are available. We are going to study those in later. The official definition of pharmacology is the science of drugs. The word pharmacology is derived from a two Greek word. Those are pharmakon and logos. Pharmakon means drug and logos means discourse or study. So the word in combination known as the study of a drug. In a broad sense, pharmacology deals with the interaction of exogenously administered chemical molecule with living system and any single chemical substance which can produce a biological response as a drug. Means in pharmacology we study that any chemical substance that we introduce in our body or administer in our body, how it interacts with our system, and if any chemical molecule which we introduce in our system in our body, if it shows effect, if it shows biological effect, it's called as a drug. Pharmacology has two main divisions: pharmacokinetics and pharmacodynamics. In pharmacodynamics we study what the drug does to the body. This includes physiological and biochemical effects of drugs and their mechanism of action at organ system. Means how a particular drug responds, means how a drug show response on our body, and also include how what mechanism is working to in showing that particular effect on our body, that we study in the pharmacodynamics. On the other hand, in pharmacokinetics, we study what the body does to the drug. This refers to the movement of the drug in and alteration of the drug by the body. Includes ADME, stands for absorption, distribution, metabolism, and excretion. Means in kinetics we study the movement of drug in our body that passes from absorption, distribution, metabolism, and excretion. That means what when after introducing the drug in our body, what our body does to the drug. First it absorbed it through our stomach or intestine. After that, it the drug absorbed drug is distributed through the circulatory system and then metabolized by our liver or the kidney or other body organs. After the metabolism, the metabolite of the drugs is excreted out through the body, through the feces or in the urine, also through the sweat or through the lungs, in the passing of the in the exchange of the gases. There are other important aspects of pharmacology are also available. We said that pharmacology has two main divisions, but those divisions are main but also have other divisions also. So first we are going to discuss about the drug. What is drug? According to WHO, drug is any substance or product that is used or is intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. It means any substance that we are given to modify or explore physiological system. What is it meaning? If there's any disease or any disorder, we give a drug intended, or there are the doctor's intention is that we are giving drug so that particular disease or a disorder get cured. For that, or could be for the diagnosing process also. Means doing we give drug, and we also give drug to diagnose a particular disease. So, and also for the benefit of the recipient. Clinical pharmacology. It is the scientific study of the drug in man. It includes pharmacodynamics and kinetics study in healthy volunteers as well as in patients. Evaluation of efficacy and safety of drugs and comparative trials with other forms of treatment, surveillance of patents of drug use, adverse effects, etc. Means in clinical pharmacology, we test the new drug or it could be a possible old drug. So, what we do if we are developing a new drug, so it is necessary to know the efficacy of that particular drug and also the safety of the that drug. So, we conduct trials first on animals, that is known as preclinical trials, and when the animals the trials get succeed, we know that that particular drug is safe and has an effect for a particular disease, then we start the clinical trials. Clinical trials has three phase 1, phase 2 and phase 3. In the phase 1 we give that drug, that new drug or could be a possible old drug. Why we are doing a test again on a old drug? Because we are trying to find a new therapy for a particular drug. Means there's a drug that before used for the treatment of fever. Now we are find out that it could be used for any other disease also. So for that, if we are using it is eventually effective or not, that we are testing for the old drugs. In the new drugs, during the clinical trials, in clinical trials we conduct these trials on humans. In the phase 1 we choose healthy volunteers, and the number of the volunteers is 100, and we conduct the trial. We check that the drug is safe. In the phase 2 we increase the number of volunteers, and in the third phase we also increase the number of volunteers into thousands, 3,000 to 5,000, and we check the safety and efficacy and toxicity of the drug. If the toxicity of the drug is manageable, if the benefit and the risk ratio are good, if the particular drug has a low risk in comparison to benefit, then we launch that particular drug in the market. That is clinical pharmacology. Chemotherapy, it is the treatment of systematic infection or could be a malignancy. What is malignancy? Malignancy is a term used to describe cancer or disease that cause abnormal cells to grow and divide without control. So, malignancy could be used for cancer or the abnormal cell growth. With specific drugs that have selective toxicity for the infecting organism, malignant cell with no minimal effect on the host. Chemotherapy, we use a drug type that has an effect for the malignant cell but doesn't have any effect on the host cells, or we can say the good cells, that those are dividing in a controlled manner. On those, the particular drug or the chemical doesn't show effect, or if showing, then those effects are really minimal. But these drugs are used to kill the particular cells that are growing abnormally or could be a cancerous cells. That's chemotherapy. Now the next definition are f- about pharmacy. So pharmacy, it is the art and science of compounding and dispensing drugs or preparing suitable dosages for dosage forms for administration of drugs to man or animals. It include collection, identification, purification, isolation, synthesis, standardization, and quality control of medicinal substances. Means pharmacy is an art and science where we compound and dispense the drugs, or could be prepare dosage forms suitable for the patient. For preparing the dosage forms, first we collect a particular uh, substance, then we identify that particular substance, and then purify, isolate, synthesis, standardize, and quality control of medicinal substances. In toxicology, it is the study of poisonous effect of drugs and other chemicals with emphasis on detection, prevention, and treatment of poisoning. It also includes the study of adverse effect of drugs, since the same substance can be a drug or a poison depending on the dose. So, in toxicology, we study the poisonous effect of drugs and emphasize on the detection and prevention of that particular poisoning, and also the treatment of that particular poisoning of a substance. It also include the adverse effects. So what is adverse effect? Any unintended or a noxious effect on a man at a normal dose that is given to a man for a diagnosing or to treat a particular to treat a disease. If on that dose the it shows noxious or unintended effect, those effects are known as adverse effect. Any substance that if we raise the dose of that particular substance, it could um, be shows adverse effect or other side effects that could be poisonous. That's in this lecture. This is my first lecture on YouTube, and I'm pretty nervous, and I knew I also do lots of mistake in the video, but I try that in future I will reduce those mistakes and also create a good content. Thank you for watching my video. I assume you learned something about it. If you don't, you can mention in the comment section your feedback. Thank you for watching my video.